Alrighty, well, good evening, everyone. Again, my name is Savina. Thank you so much for being here with us tonight for what is lymphedema and understanding your risk after surgery, as well as tips for a lifestyle balance. We're so glad that you can all join us tonight. Please note, as I mentioned, the program is recorded and we will send you the link of the recording after the program. Now, before we get started, I would just like to share more about the center and the services that we have here. The Cancer Wellness Center was founded in 1989 as a nonprofit organization with the mission to improve the physical and emotional well-being of those impacted by cancer and their loved ones. Our services, which are currently both virtual and in person, include education programs like the one this evening that aim to help you navigate the varied challenges that come with living with a cancer diagnosis, wellness classes like yoga, nutrition, mindfulness, and more that provide a holistic approach to healthy living, and support services which include counseling for individuals, families, couples, children, and those bereaved, as well as support groups that are designed to help our participants manage the mental and emotional impact of cancer. If you would like to learn more about the center and connect to our free programs and services, please visit cancerwellness.org, and the link will be included in the chat. Now, without further ado, welcome Stephanie Dizan. Thank you so much
Hi,
for being here.
awesome. Let me go ahead and share that screen. Hi, everyone. Thank you for having me here today. All right, here we go. So thank you to the Cal Cancer Wellness Center for having me here. As Sabina said, I primarily work with patients who have lymphedema or those who are at risk of developing lymphedema. So typically when I have my patients here, they're always asking me like, why didn't I know about this sooner? Or why hasn't anyone told me about this before? So I'm really glad to share this information with you all today. So here are some of the goals that I hope to hit for this presentation. The first being, what is lymphedema and what does it do? Second is factors that may lead to a higher risk of developing lymphedema. Habits to promote lymphatic function, and then steps you should take should lymphedema occur. So there's a lot of trigger and fear and anxiety that comes with the word lymphedema after having done a lot of treatment after cancer. And so we hope by the end of this presentation that you have gained a better understanding to help you with challenges post-treatment or even during treatment. So what is lymphedema? We need to go back to the basics of what is lymphedema. So it's a condition of localized fluid and tissue swelling caused by a compromised lymphatic system. So when you get lymphedema, it is lifelong. There is no cure for it. Versus when you get edema, generalized edema, for example, after surgery, it's normal to get edema after surgery, right? It's expected to self-resolve over time, but dependent on how severe the surgery is, the edema can persist for a longer period of time, but that's temporary. So when we see the whole body swelling, you typically need to first know why the swelling has occurred before we say, oh no, this is lymphedema. There might be a different cause or reason behind it. So typically I treat patients with secondary lymphedema, and that's a condition that's caused by an insult to the lymphatic system. So typically there's a diagnosis or there's a trauma that led to an overloaded lymphatic system, which then caused lymphedema. So ways that the lymphatic system can be overloaded is with surgery. So for those that had lymph node dissections, that's a lot of load on that system. Radiation, trauma, a tumor, an infection, even obesity, where the lymphatic system has a hard time circulating throughout your whole body. Chronic venous insufficiency, so that's when you have insufficiency of the blood from your legs coming back up to your heart, and then other mosquito infections such as that one. So again, lymphedema is a lifelong condition. There is something called primary lymphedema. I treat those a little bit more rarely because they are on that rarer side, but that means that they have a poor anatomical design. So it can occur at any age. Some people are born with it. Some people it comes when they're a teenager or even when they're 30s. So this is an example of secondary lymphedema and what it can look like at the most severe side, and then after treatment, after being with us here in therapy. Another example is here. This is a person with mastectomy and lymph node removal. So it's a breast cancer related lymphedema. And we're looking at the arm before and after. So what does the lymph system do and why do I need to worry about it? So first, it fights infection, right? It carries those white blood cells all around your body and it fights bacteria and infection. It's also in charge of transporting fluid back into the blood circulation. So it filtrates all of those waste products and brings it back into the rest of your system. So honestly, think of it like your sewage system. And so when you're looking here at the picture, you have lymph capillaries that are located right underneath your skin. It's very superficial. But then that goes and it drains into your, for example, your axillary nodes in your armpit area. There are other lymph nodes located everywhere in your system, but then those lymph nodes, they're in charge of fighting the bacteria. It contains all of those white blood cells that break down and fight the virus or bacteria. Then those nodes over here, for example, where's my little cursor? There it is. The nodes then help to drain it back into your system, back into the circulatory system. Some of it goes there, and then some of it goes to your kidney and your liver, and then you either remove it as a part of your bowels or urine. So I get asked that, where does all that lymph system or where does all that lymph fluid goes? You either pee it out or the other way, right? So when we're thinking about parts of how the drainage system works, because it's pulling all of that filtration and waste out of your body, the upper quadrant drainage. So for those who have breast cancer related or even like neck related cancer, this is where it drains to. So for example, your axillary lymph nodes, it is in charge of draining your chest area, your posterior side, your scapula area, and then your arm. In comparison to the lower quadrant drainage, you think about your groin. So this is the body area where it's like below your abdomen, and then anything that has to do with your lower back and your buttocks and your legs and your genitals as well. So where does that all go into? Your main lymphatic system is in your abdomen. And so what really matters, a lot of the things that I incorporate in my treatment is to stimulate your main lymphatic system, which is located in your abdomen. So by doing deep diaphragmatic breathing, which is just a normal thing, which has a lot of benefits, that can also stimulate that circulation. So let's do some together. So we're going to breathe in through your nose and you let your belly rise, and then you exhale through your mouth. You push your tummy in. So they typically say, smell the roses, inhale through your nose, and then exhale, blow out the candle through your mouth. And even doing that 5 times, don't do 10, just 5 times throughout the day will really help to circulate that. Okay, so why do I need to worry about stressing my lymphatic system? So instead of giving you a whole kind of graph over here, we'll think of it like an analogy of like what happens when we stress the lymphatic system. So your lymphatic system, it has a certain amount of load. So think of a dump truck. It can only allow a certain amount of dump into that truck. And so it has a certain amount of transport capacity is what it's called, the amount of lymphatic load. So what's included in that load is the proteins, the water, the bacteria, the white blood cells, all of that stuff. The lymphatic system is in charge of grabbing. But then it has a certain amount of load, right? But then if you think about overloading that system, all of that fluid gets spilled out. And so basically it goes into your extremities where you see that picture that I was talking about where your arm or your chest area, any part of your area of your body gets a little bit more swollen. So what does it look like? So some of my patients, they may or may not have crazy pain, but obviously the swelling comes with that. They talk about numbness and tingling sometimes. Heaviness for sure. A lot of my patients complain that it just feels heavy. They might not even see that it's swollen, but they just know that something is off with that extremity. And on the other side, where it's progressed a little bit more, there will be some tissue texture changes just because you know that the lymph system is right underneath your skin. So this picture is showing like when I press into your skin, it'll pit like that. And that's typically a sign of it. So that these are like one of the handouts that I'm hoping to give to you guys, or if Savina has given to you already. It's just a self-check inventory of checking your symptoms to monitor symptoms of lymphedema. So if you're questioning it, it's kind of good to objectively kind of monitor that on a weekly basis, whether that certain extremity that's involved or at risk is feeling one of these symptoms. And then it will be really good to like go back to your therapist or to your doctor with this inventory to let them know these are your symptoms. So at that point, I'm going to pause. If anybody has any questions regarding what the lymph system does or what it is, I'll take some questions if you guys have any. And I think Sabina said here that handouts will be included after the program. So I'll let you guys know which handouts are going to be included.
Yeah, thank you so much. We've just no questions. Just a couple people have indicated, both publicly and privately to me, that there's some affected, kind of both primary and secondary lymphedema, all
Sure.
three limbs, and then we've had a couple people reach out saying they have lower extremity lymphedema.
Okay, got it. Thank you, Sabina. Okay, we'll move on. All right, so the next part of our program would be factors that may lead to higher risk of developing lymphedema. So knowing your own personal risk and what's involved. So with this, with the personal risk, what's out there right now is a lot to do with breast cancer related lymphedema. And so that's what I'll be sharing with you all today. But it is transferable just based off of like what we know about the lymph system. So you'll see what I'm talking about in just a sec. So there is unmodifiable risk factors, things that you cannot change versus modifiable risk factors, things that you are in control of doing. So according to research, those who are at risk of developing breast cancer-related lymphedema, if you've had more than 3 lymph nodes removed, that increases your risk again on the axillary side. So if you think about more so on the groin, you think about like in proportion. So for example, in the axillary, you have about, I would say 15 to 20 lymph nodes. And so that's on average on every person. And so it may change, but then having 3 lymph nodes removed already increases your risk. So if you take that in proportion, for example, the groin, your groin typically has more than that. I would say about 40 to 50, depends. Whereas your abdomen has like hundreds of lymph nodes. So 3 lymph nodes is not going to increase your chance for those related lymph nodes, right? But then for your arm, it's kind of limited. So research has shown that more than 3 lymph nodes removed increases your risk. If you've had radiation to that area. So again, not just here, but even your lower extremity trauma. Radiation is trauma to your skin and therefore your lymphatic system. If you'd had chemotherapy, and also, this is an important one, your BMI at the time of the diagnosis, if it's higher than 30. And then other complications during while you had treatment, if you had an infection, a seroma, or some sort of porting in your axilla. And then this was a new one that I saw recently was if you lived in the rural residence, I think the article was talking about accessibility. If you're not being closely monitored, that increases your risk of developing lymphedema because you don't know what to watch out for. And so for modifiable risk factors, we're thinking about things that you can control and change and do more of like healthy lifestyle habits. So you think about taking care of your skin because your lymphatic system is overloaded. Trying not to cause trauma or injury to that side. Try not to overuse the limb, but also trying to not use it and prevent overall use. So there's a fine balance between both. Definitely changing your BMI. So you are in control of your nutrition and management of that. And activities that put stress in that area. So I'll talk more about the modifiable risk factors in a second, but we're going to go more into like what's your personal risk for those things that you cannot change because that's the doctor's choice of which treatment you guys are going to do and that you can't change that, right? So for stratification of your risk. So for example, you are at high risk if you've had all of your lymph nodes removed in your axilla, because then there's nothing there to drain that area back out. Chemotherapy, it's a very extensive trauma to your whole body, and then radiation to that area, and then also the BMI. So if you've had all four of those done, you are at high risk. So then you get into more of the medium risk if you've sentinel lymph nodes removed. That's a way for them to know if the cancer has spread or not. And so the number also matters. If you had radiation to that area, and then again, if your BMI is higher than 30. So that BMI, as you can see, is a really big risk factor in all of them, right? And then you are at low risk if you'd had less than 3 lymph nodes removed, you had maybe a lumpectomy or mastectomy, but you did not need radiation, you did not need chemotherapy, and your BMI is at a good level. So based off of that, kind of see where you're at, high risk, medium, or low. So what are the things that you guys are in control of? So this is another handout that Savina will provide after the program. What are those healthy habits that you can do? So obviously getting medical checkups and making sure that you have a good diet and exercise. That's 101. But really, one of the things that I see here in the treatment is the importance of skincare and reducing the risk of infection. And so it can get into your nail beds. And so if you're not cleaning your nails or making sure the toes are clean, that's the first route that it can go to. Or even like nicks and cuts, especially during the winter time, that's a way for an infection or a bacteria to get in and cause an infection. So really taking care of your skin is very important. Other ones that have deferring research is extreme temperatures. There was a couple research out there that like if you went into a sauna or very like a tropical area, so, the lymphedema increases just because there's more blood flow to that area when you're introduced to higher temperatures. And then another one was limb constrictions if you're wearing too tight of like a watch band. But again, that one is kind of like variable research. I would say more of like these are the most important ones. And so you hear a lot that says, don't do this, don't do like an injection on that side, or like don't do a blood pressure cuff on that side. A lot of do's and don'ts. But really it's all about making an informed decision on seeing where you're at that personal risk that I just talked about. If so, for example, if you're at like a high risk, then I want you to be on the more proactive side, right? And really kind of making sure that you're being closely monitored, you know the symptoms, you have a doctor and a lymphedema therapist that you're working with. Versus if you're on that lower risk side, then I would say be a little bit more flexible on that side and just making sure that you're educated on what lymphedema is and you're exercising. But all of these things like the air travel or like the temperature, the blood draw, I wouldn't worry too much about it. But as a part of Endeavor Health, we do follow these precautions, and just knowing to ask for help is like the main thing. Okay, so we went over the lymph system, we went over your own risk, right? And so I kind of briefly touched about habits to promote lymphatic function. And so we're going to go into more of that. And so, do you guys have any questions so far?
Nothing in the chat.
Nothing in the chat. Thank you, Sabina. Okay. So, habits to promote lymphatic function. There is one main thing that research has the biggest evidence on, and that's with exercising. Surprise, surprise, surprise. So basically, we know that your lymphatic system is right underneath your skin, right over here, but it also sits on top of muscle belly. So when you're contracting those muscles underneath, you're also facilitating the flow of that fluid to run along with you. So it's not just exercise, dilly-dally, do it. It really matters on contracting those muscles so it moves the fluid along right underneath it. So this is also going to be a part of the handouts for you guys. So for those who are at risk of developing arm-related lymphedema, we think about moving that area, right? So if you'd like to join me, please feel free to do so. I'm going to take about 3 repetitions so you kind of understand what these exercises entail. And so really doing some neck motions, going forward and going back, because what we're trying to do is drain a lot of the lymph nodes here. So when you get sick, right, this area, sometimes the tonsils, they get inflamed. That's part of your lymphatic system. So you're kind of saying, wake up. I'm trying to wake you up, move that lymphatic fluid that might be stuck there. Then you could do some shoulder blades, some up and rolling, up and back, really good for posture. Then you can think about squeezing your shoulder blades, opening your chest and squeezing back. That's very important. Oftentimes after breast cancer related treatment, you get a lot of radiation, a lot of trauma to the chest, and then you want to curve in. So I really tell all my patients to open that chest and open back and squeeze back. Another good one that I like is rowing, right? So reaching and squeezing. And you're thinking about bending the elbow. You do have some lymph nodes here, so that'll help. That doesn't get taken out. So you can go ahead and do a lot of that. Some wrist circles to move the lymph system in your forearm, opening and closing the fists. Some of my patients, they start having swelling at the back of their hand, and that's often like a first symptom for them. So we really want to get that lymph system flowing. And then the deep breathing. And as you guys know, that's the main one. So for exercises regarding for the leg, we think about still one of your main system is in your shoulder. So I really like that. The deep breathing is important. And then you could do this seated or standing. So I'll stand up for you guys so you could kind of see where you're raising that hip up and down, alternating those marches, right? And then thinking about doing knee extensions. So you could do this seated. A lot of my patients with lymphedema in their leg, they're like, I can't stand up. I can't do exercises. Nope, you can do them seated. You can do them whenever you're just sitting there. You could do some exercises, and these are all gentle. Some of our docs, or most of our docs, if you have swelling in your legs, will tell you to elevate, to just let gravity assist to bring that foot down. While you're elevating, you could think about moving your ankles up and down, contract those muscles, and then putting it into circles. Okay, so if I haven't reinforce that enough. Really, there is no crazy adverse effects if you exercise after breast cancer treatment, after any type of treatment. It'll just get that lymph fluid flowing. Okay. A lot of my patients, they're scared. What if I lift too heavy? What if I carry a grab groceries? Is it gonna pop up all of a sudden? No, it's not gonna do that. Um, as long as you are doing it like gradually, right? And with lighter weights or even just moving, that's enough. So, a lot of research again to just back up. There was a weightlifting group that showed that they didn't have any increase in risk of lymphedema. There was patients who are after like doing yoga was another one that's had good research regarding promoting lymphatic flow because you're deep breathing in yoga and you're moving all of that. So if you guys have any like doubts or concerns, I would definitely suggest just maybe starting out with a like personal trainer or using us as a resource, right? So we're therapists, we know how to exercise. So if even if you don't feel like you are at risk of developing lymphedema, I think it's still important to know how to get back to exercising, and that's what we're here for. So really being mindful, right? If it hurts, back up, do it a little bit less than that. Go slow and gradual. So maybe instead of saying, I'm going to lift 10 pounds, 5 reps, maybe you're going to do 2 to 3 pounds, 20 reps, right? So less resistance, higher repetitions is always my recommendation. And for those who already have lymphedema, yes, I do recommend wearing a compression garment, but only under the guidance of getting fitted professionally and if it's medical grade. So we'll talk about more of that later and how I feel about Amazon or over-the-counter related garments. All right. So that's a picture of my mommy. She was my model here. So this is a really good exercise to promote diagonal patterns, but it really hits like front and back muscles. It's just like a double whammy that incorporates deep breathing. So you don't have to do it with weights. She was sore after this, and that was, I think, a 2 pound weight. So you don't have to do it with weights. So what you would do is you would start from the back here. Then you would inhale and open up. And then you would exhale, bring it back down. So there's a little bit of a trunk twist, but don't like go crazy. So inhale up and open and exhale down. So that's a good one. And then, so we think about like drawing a sword or like the cheerleader move, something like that to help you remember. And then if we think about these two at the bottom, like a seatbelt, I guess. So you would kind of get that seatbelt and cross the chest and open. And again, inhale here and exhale open. So this is a good one to kind of hit all of those muscles at once. All right. So we talked about the lymph system. We talked about your factors, whether you're high, medium, or low. What habits to promote the lymphatic system. And so the next one is steps you should take should lymphedema occur. Any questions so far? Let's take a look here. Chat. Ooh, that's a good question. It says, how soon after surgery radiation would symptoms appear? So after surgery radiation, I think there is such a thing as such as like a post-radiation swelling, post-surgical swelling. All of that is temporary, and that can occur, I would say, for 6 months, 6 to 8 months. So I typically tell my patients, you don't know if this is true lymphedema quite yet. It takes a while for your body to just regulate to everything that's been going on. And so it's like you can't tell right away, not unless like your whole arm blows up, because sometimes people will just have swelling in that surgical area and that site, right? Or that radiation site, and they'll have swelling there. All of that stuff, you don't know if that's there to stay until maybe a year out later, until your body has had time to regulate. So honestly, give yourself some grace that your body's still healing. And if you have fluctuations in the swelling, it is normal, but I want you guys to be reaching out to your medical professionals to let them tell you that it is normal. But I'm also telling you that if it's fluctuating up and down, it could be just post radiation or post surgery. Okay, let's move on. So steps to take should lymphedema occur. Call your physician. That's just 101, right? You don't know where that swelling is coming from. It might not be lymphedema. It might be a symptom of something else. Like edema in general, it's not a diagnosis. It's a symptom of something going wrong with your body, and we need to figure out why. So what I do want you guys to really know though is if there is an active infection going on. So if there's redness and there's a red spot, so as you can see here, this is so different from there. And there's like a border, like where the marker is laid out. It's typically a way for us to know whether there's an infection that's spreading. So if there is an active cellulitis, which is an infection, just a general term for infection, that redness will travel within 20 minutes, within 30 minutes. It's pretty fast. So it's not something that's like gradual onset, like a lymphedema that will happen years. It takes years for it to just get bigger. This one will just get big overnight. Okay. So do know that. It'll feel warm. It'll feel like a different temperature than your other side. You wouldn't feel good at all. You'll know. But some of my patients actually tell me that they didn't have fevers or chills, but then they just knew that it was just red and then it was hot. So obviously increased swelling will happen, and then pain for sure. A lot of pain in that involved site. So when this happens, it's not, oh, call my doctor. It's go to the emergency room. Okay, so there's a difference between edema that increases over time versus a sign of infection that requires immediate care. Okay, so back to lymphedema. There is no cure, like I said, but there are ways to conservatively manage and to let you guys be as independent as possible while keeping quality of life and balance and all of that. So when you guys come here to our door, it's called lymphedema therapy, but also called complete decongestive therapy, because we are trying to decongest a congested system. Your lymphatic system's congested. So if you've already had like an onset of lymphedema, you're going to first hit that intensive phase, that initial rehab where we are trying to reduce the size of your limb. But if you're coming in where you're at risk of developing lymphedema, or you don't know what lymphedema is, but you know you've had cancer and so you want to learn more about it, then we kind of skip on to the self-management phase and teaching you and educating you all about that. So I'll go over each of these individually. I don't hit all of them for every patient. Every patient has individual needs, and so I base it off of what they need. So a lot of you may have heard there's massages that come with lymphedema, right? So this is called your manual lymphatic drainage. We're stimulating the lymphatic nodes where we know they're located, and we're rerouting where, say it's affected here, we're going to tell that lymphatic fluid to move to the other side where things are working to that other side, or we'll tell it to go down to your groin. Similarly, vice versa, if it's in your groin, say you had a hysterectomy or some type of ovarian cancer or something like that, your groin system is the one that's deconditioned or affected. So then you would aim up towards your axillary system. So it's a way for us to use our hands because, again, your lymph system is right underneath your skin. So we could actually influence it by lightly moving it. But then if you've had actual lymphedema and it's already a bigger sized limb, we do go into compression bandaging. And that, as you can see here, it has a lot of layers to it. But I tell my patients all the time, it is temporary. It's only the phase one to reduce it back. And then hopefully we get into the point of transitioning you into a compression garment system. So this might include your compression stockings that you might hear of, or your compression sleeves, or even a compression bra, or even like an abdominal compression. So wherever your lymph system is, needs a little bit more external pressure to push the fluid out. So this is my little caveat for those of you who are trying to who know they may need compression garments, but then they try to explore somewhere else. So please do not buy it online. Please get fitted by a professional. There is a detriment to you not having a good fitting compression garment. It might cause restriction of blood flow, so don't do it. Please do it under the guidance of a professional, okay? So I often get asked that, should I even wear a compression garment, right? So I'll break it down to you. So if you guys are at lower risk, research has shown that if you should just be educated, like how I'm educating you guys now, on the symptoms of lymphedema, be screened for it, and to know whether you are low risk, high risk, or medium risk. So just knowing and educating and then being flexible about all of that. Now, if you are into the medium risk over here, we do recommend that you are going to need to wear a compression garment, whether it's a sleeve or an abdominal one. Just within like the first like 4 weeks or 6 weeks of like the treatment of whatever cancer treatment you've received, just to make sure that we are kind of on that preventative, proactive side. And then if you are at high risk, again, if you've had higher BMI, radiation, chemotherapy, and then say a lot of lymph nodes removed, you're at high risk. We definitely want you to get the referral to us or to a lymphedema practitioner that will send you to us, okay? All right. So other questions that I get asked is like if dry brushing, people ask me about dry brushing. That's getting common where it's a brush and you are kind of massaging that area. There's no evidence out there that says it's detrimental to you, but then you have to learn the right sequence to do it. And so doing it under the guidance of a lymphedema therapist is important. I get asked about diuretics as well. We need to ask the doctor about that, whether diuretics is actually helpful or it can be possibly harmful. So if you're thinking about doing diuretics, if you have true lymphedema, say primary lymphedema, diuretics is not good for you. If you have secondary lymphedema where it's due to the veins first and then lymphedema after, maybe diuretics can help you. So really talking to your doctor about that. Other ones is acupuncture, herbal supplements, yoga, tai chi. All of those are like not the normal traditional Western medicine, so therefore we don't have a lot of research out there. But still, if you are doing it under a guidance, you're doing it slow, and you're kind of monitoring your symptoms, there's no research out there that says it's detrimental to you. Okay. Other self-management that I've gotten is people ask me about compression pumps. That's another one. And so that would need to be recommended by a doctor or a therapist like me to see if you even would be a candidate for one per se. Medicare does not always cover for these compression pumps. And so we talk about whether we can add that as an adjunct to your treatment. It's not the main treatment, right? So I get patients that say, I've been doing the pumps once a day and elevating, but my legs aren't getting better. That's because it's only just an additional part of the treatment. It's not the main treatment. So we do not rely on the compression pumps here. Um, and similarly to these other two, like kinesiotape and low level laser, we don't rely on those. The ones that I talked about, exercises, drainage with the massages, and compression bandaging, those are the main forms of treatment. Okay, so almost done here, you guys. So when you are looking for lymphedema practitioners, for example, I am an occupational therapist, so I'm an OT, and then there are other ones out there, like a nurse can be certified or a physical therapist can be certified. So getting that order in for PT or OT lymphedema referral, that's what you would ask for your doc, okay? And you would get someone who has this certification at the end of their name, CLT Lana. So if you are looking to seek services through Endeavor Health, these are the numbers. And then also under the consultation of our lymphedema doctor through Endeavor Health, his name is Dr. Joseph Feldman. If you guys know him or don't know him, he will be someone who can look at you globally and see whether lymphedema treatment is the right course for you. All right, that is the end of my presentation. I'll leave this part open. Thank you guys for having me present, and I'll open it up to questions now.
Thank you so much, Stephanie. Before I disable the or enable the audio, the one thing there are a couple questions that came in the chat. One that I see in here, if the at-risk area also has arthritis, does that increase the risk for lymphedema?
No, arthritis and lymphedema is not correlated. It's not correlated. There's no research out there that says if you have arthritis, you have a higher likelihood of developing lymphedema. No.
Thank you.
Mm-hmm.
Then a couple that came directly to me. One person indicates they've developed lymphedema after breast cancer surgery. The person notes working out about 5 times a week and goes to the steam room after each workout for about 10 minutes each time. Is that too much time and or frequency in the steam room?
Oh, that's a hard one. If you have lymphedema already and there is swelling, I would stay away from that steam room. That increases the blood flow to that area and increases the swelling in that area. So not unless you have a good fitting compression garment that will contain that swelling while you're in that steam room, I would not advise it. I would make sure to be monitored by a lymphedema therapist so that we could kind of play around with a good balance. Like if you love doing the steam room because it relaxes your muscles, I want to have that for you, but is there a way where we could balance that where you're not doing it every day, that maybe you're doing it every other day? So I would be closely monitored by a lymphedema therapist if you already have lymphedema and you're going to a steam room daily.
Thank you.
Mm-hmm.
Then another question is the person notes having exactly 3 nodes removed. Is that still considered the low risk?
It would depend on the other risk factors. So if you've had about 3 lymph nodes removed, 3 or more, so that includes that. But then you have to think about the other treatments that were involved. So if you've had also radiation, if you've also had chemotherapy, and your BMI is higher, you're at high risk. Let's say you've had just 3 lymph nodes removed, your BMI is good, you've had no radiation, no chemotherapy, you're at low risk. Does that make sense? Hopefully.
Thank you.
Mm-hmm.
And then one other one just came in is, do you recommend continued elevation daily after lymphedema indefinitely?
Definitely no. So I would say a balance of both. It also depends if that lymphedema is primary lymphedema or secondary lymphedema. If it's primary lymphedema, no amount of elevation could help it. It's really the compression that is the gold standard for containing the lymphedema. It'll kind of like hold it, but it's not going to work as much. But if it's a secondary lymphedema, yes, I do want you to elevate, but not more than I want you to move. There's more research on moving and exercising, getting all of that moving. I've gotten more patients since COVID started because people just didn't have a choice but to have more of a sedentary lifestyle, right? To stay within their homes. And so all of a sudden their legs are starting to swell because they're sitting more. Versus if they started to move more and I got them moving, then you would see all of these symptoms kind of at least stabilize.
Thank you so much. And
Mhm.
just a little plug for movement. Here at the Cancer Wellness Center, we do have a variety of movement related classes in addition to yoga and exercise that you're welcome to join us. I put the link in the chat here earlier today for our website. I'll do so again. Another question that came in that's a general question is bilateral mastectomy plus reconstruction plus chemo, 14 tight and 18 left axillary nodes removed high risk?
Yes, I would consider that a high risk. So at the top of that risk stratification chart, you're at high risk if you've had an axillary lymph node dissection. At that point, 14 to 18 lymph nodes, that's about most of your nodes. And so, yes, you are at high risk.
Thank you, Stephanie. And then is the risk considered lifetime? So if somebody had chemotherapy a few years ago, would they still be considered a high risk with all the other factors that you mentioned?
Yeah, so yes, that's the thing that I want to teach patients that the risk is lifetime because you've had all of that trauma done, and the radiation, there are permanent changes after radiation effects. Chemo just changes your body, but it really depends. Like, so say you had chemo and then your BMI is higher, and then you've had radiation and you had all those lymph nodes removed, you would be at risk for a lifetime. But then can you lower your risk a little bit more, right? Because I talked about modifiable risk factors of lowering your BMI and getting that nutrition and more of a healthy lifestyle and doing that skincare. Would that lower your risk? Yes. And then would I want you to be more flexible after lowering that risk? Yes. So I would say that really depends.
Thank you, Stephanie. What I want to do is, because I know there's a couple people that sent messages that their questions, they're not seeing them through. So I'm just going to